Well, sometimes, the chemotherapy makes you feel kind of puny anyway, and sometimes when you're feeling a little sicker or a little more tired or a little bit out of sorts, not knowing whether that was a problem or whether that was just expected as a result of the chemotherapy. It would be beneficial because everybody has their cell phone on their body. You may have a piece of paper that the doctor gave you with some information, but God knows you probably don't know where that is. And if you have something that's quick at your hand, which everyone keeps their cell phones with them, and then if you have a little triage list of symptoms or problems as to what is to alarm you about or to alarm your physician about or seek immediate care, that will just take some of the questions and the panic out of what you're experiencing.
Okay.
I think it's helpful because a lot of times when a patient goes to the physician, they may have had a multitude of things happen, but you get in the doctor's office, you forget things. So this way, if you had communication in between the doctor's visits, if there's a problem, that way you can kind of have a running track of how your patients are doing when they're not in the office. It certainly can tell you whether patients are or are not having problems. So, if you have a problem and it's not major, this will be a way to communicate it to the doctor. So when you go in, they say, oh, I see last week you had a fever. I see last week you were nauseated. Then it can give you a way to make sure that that problem was either taken care of, or is it still a problem, or, okay, next time if it happens, tell the patient, this is what you need to do because you've communicated that to me. So it just gives you more information about what's going on with your patients, which always helps. It's a very nice and easy, user-friendly type of an app, and it's just with a click of a finger getting some information back. That's just, and again, it's just a way to have more communication with your patients and more what's going on, so you can ultimately, obviously, take the best care of them, but also if they've had a problem in between visits and you've been notified of them, then you can discuss them more thoroughly when the patient's in your office face-to-face. One of the advantages of this is that if a patient is having a problem, they can email information to the physician. It ultimately can save a phone call because when the doctor gets that information, they've got it there to contact back the patient if it's necessary or if it's something emergent or not emergent. Either the physician or the nurse can save the patient a phone call with a step, and they've already got the information at their hands so they can get back to the patient to tell them what to do.